Hi, my name is Dr. Daniel Fox. I'm a licensed psychologist in the state of Texas and an expert in the area of personality disorders. And today I wanted to do a video on borderline personality disorder and bipolar disorder. Now, these two disorders are often confused. Not only do they tend to confuse clients or individuals that experience these symptoms, but it also confuses a lot of mental health and medical providers. So what I want to do here is I want to help sort of delineate a lot of that confusion, break it apart, break it down so it's easier to understand. Okay, so today in this video, we're going to talk about, briefly define what borderline personality disorder is. Then we're going to define what bipolar disorder is. And then we're going to talk about sort of that misdiagnosis rate and where some of that confusion comes in. And then we're also going to talk about what the research is saying and why is the research important. From there, we're going to talk about treatment approaches, and we're going to talk a little bit about medication. Now, I'm a psychologist, not a psychiatrist, so I cannot prescribe medication, and I'm going to make sure that I stay in my lane when we talk about medication. And then we're going to talk about that there are different therapeutic approaches that can help those with bipolar disorder that also help those with borderline personality disorder. So why don't we get started? And what we'll start off doing is sort of explaining what borderline personality disorder is. Now, if you've seen my other videos, you know that I've talked about borderline personality disorder and borderline personality disorder traits. And so what I'm going to do is I'm going to pull all those together for a brief definition. I don't want to take too much time on that. So what borderline personality disorder is we see that it's individuals that tend to be highly reactive, tend to have a lot of issues of abandonment, emptiness, a lot of personal confusion, unstable self-image, a lot of uncertainty about self as well as others. And these issues tend to manifest when they have this sense of loss, when they experience this sense of being left alone, abandonment, emptiness, other types of issues as well. And so what happens is that these individuals, as they become highly reactive, and in that reactive state, a lot of times it becomes confused with bipolar disorder. So what is bipolar disorder? So bipolar disorder is that individuals that have this diagnosis is that they go through episodes where they are at the poles of behaviors. And at the high pole of behavior, that's a manic or hypomanic episode. And in these episodes, these people have a lot of energy. They may not sleep for several days. They might need sleep for several days. Promiscuity, shopping sprees, gambling sprees, excessive cleaning, sometimes intensive irritability, and other factors as well. And now this video is not for diagnosis. We're just talking about these two disorders. If you think that you may have borderline personality disorder or bipolar disorder, or both, that it is important to talk with a mental health provider who is skilled at not only diagnosis but also treatment as well. So I just want to, I know I digressed a little bit there, but I want to be sure that is also very clear. So we're talking about that upper pole, that manic or hypomanic phase. Now what happens is that you're up in that phase for a period of time, and then you slide into this lower phase, which is a depressive episode. Now typically it's a major depressive episode, and the depressive episodes tend to last longer than the manic or hypomanic episodes. Okay, so the big identifier is, are they episodic? Okay, so are there episodes? And I'm going to talk a little bit about this too as we continue to go through the video as well. But what we're looking for is episodes. See, what happens is individuals that have borderline personality disorder, there's typically an identifiable trigger that sets them off. And a lot of times individuals with borderline personality disorder that do not have bipolar disorder, they have what's sometimes called a florid borderline reaction. Now, a florid borderline reaction is that you get set off. Okay? You have some type of trigger. Could be abandonment, could be this sense of loss, this fear of loss, fear of abandonment. Whatever hits that trigger sets you off. And that florid reaction is that immediate need to lessen a lot of that fear, that anxiety, that sense of emptiness and loss. And the longest borderline florid episode that I have ever been experienced with one of my clients was 4 hours. 4 hours was an intensive period of time for this particular individual. And we won't go into to those details, but so it was intensive. But in a manic or hypomanic episode, you're talking days. Okay, so it's very different. So that's why those episodes are so important, to track those episodes. Okay, and what about, well, part of the confusion is that 69% of those, right, that are diagnosed with bipolar disorder have been misdiagnosed initially, okay, and more than a third, 33%, remain misdiagnosed for initial 10 years when they initially become symptomatic. Okay, so there's a lot of confusion in identifying this disorder. Now, what's happened lately is that we're seeing that more people are being diagnosed with bipolar disorder that don't actually have it. And part of that confusion is that people are being diagnosed with bipolar disorder when they actually have an impulse control disorder, or sometimes it is borderline personality disorder. And what happens is that when they go on, or maybe they go to a psychiatrist or their general practitioner, and they're given medication for bipolar disorder, at the clinical dosage level, that they start to have side effects, so it's lessened or it doesn't work. And that's something that's very common with those that have borderline personality disorder, is that the medications, they don't work, or there's a lot of side effects, or you're still having reactive experiences, florid borderline reactions. And for individuals that have bipolar disorder, you see that those episodes start to decrease, that they're at baseline a lot longer. Whereas your borderline personality disorder, the individual that has that, is that their baseline, it's hard to identify their baseline. It's hard to identify where that foundation is. And if you're seeing this, you may be like, well, heck, I don't know where my foundation is. And a lot of times, not knowing, sometimes that's a subtle indicator. Remember, we're not talking about diagnosis, okay? That can be a subtle indicator of borderline personality disorder, okay? And it's important to really work to identify that. If you're not sure, there's several videos that I've done that also talk about trying to identify borderline personality disorder. So you may want to check those out. So what's interesting is that part of this confusion, this borderline personality disorder and bipolar disorder, that they can co-occur more often than you would expect. Okay, so sometimes it can be comorbid, which means that they do occur together. Some people do have that experience. So what happens is that individuals with borderline personality disorder, okay, so those who just have borderline personality disorder, it is less than 1% of the population. Okay, now bipolar disorder is that tends to occur at 0.6%. Okay, and that is bipolar 1 disorder. Okay, and now when we talk about bipolar 1 disorder, bipolar 1 is those who have those manic phases, those really high, they're for days at a period of time. It's very intensive, high energy, grandiosity, sometimes psychotic episodes can happen as well in those manic phases. And so bipolar 1 disorder and borderline personality disorder, we see that occurs in 10.7%. Okay, so now that's why it's so hard. It gets really confusing, and especially when folks don't know or haven't seen bipolar disorder before. So it's often very confusing, and they typically confuse it with impulse control disorder. Now what happens is that when there's a trigger, okay, so that trigger can set that person off, and then they have a florid borderline experience or reaction. That is not bipolar disorder. Okay? That is borderline personality disorder. And if they don't meet criteria for borderline personality disorder, okay, and they don't have those episodes, then what we're looking at is an impulse control disorder. And if someone has an impulse control disorder, they should not be diagnosed with bipolar disorder. This is why it's so important that you're really talking with your mental health provider about your episodes, about your reactions, if there are triggers to highs and lows. Individuals with borderline personality disorder typically can identify those triggers. Okay? And those triggers set them off, but not for these extended episodic periods. Okay? So they have that reaction, sometimes 4 hours, maybe more. I've never experienced anything more than 4 hours from one of my clients, but it's certainly very possible. But these folks, it's very, very different from bipolar disorder. And let's talk about the research a little bit to try to center our discussion a bit. So what the research is saying is that individuals, okay, with borderline personality disorder, that they do have that heightened instability and interpersonal reactivity to negative emotion. And you typically don't see that with folks that have bipolar disorder. Okay. And now borderline personality disorder tends to be characterized by these very intensive internal, what I like to call core content of guilt and shame. There's other factors as well, emptiness, abandonment. But guilt and shame really are the triggers for a lot of these folks, not everybody, but a lot of these folks with borderline personality disorder. And that creates a lot of instability, interpersonal reactivity, persistence of emotion over time. But that time, again, is not for days at a time. You're not at that high energy, right, where you don't sleep or anything like that. Now, no one should ever be diagnosed when they're using drugs or alcohol, okay? So that doesn't count. So if you're using cocaine for several days, you're up for 4 days, that's not a manic episode, okay? That's very different, okay? But so these are people that when they're not using drugs or alcohol, that they have those 4 days highs, and they engage in those particular manic type of behaviors. For your borderline personality disorder, they have that trigger, they have that reaction, okay? And that reaction, typically, it's not, people can't do that unless your brain chemistry is functioning in that way, which would be your manic episode. People it's not possible for us as human beings to go 2 or 3 days without that chemical push in our brain, that chemical imbalance, lack of a better word, that chemical imbalance that causes that manic episode. Okay, so you can't do that. I mean, so your brain gets tired out, you start to crash. Now, a lot of individuals with borderline personality disorder also have depression, and when you have that florid borderline reaction, then you burn off all this energy. And what I have found is that with my clients, then they fall into a depressive episode. And I also have a video on depression as well that you may want to check out if this has happened to you. So you have that florid borderline reaction, okay? Then let's say that goes on for 4 hours. So this is a lot of anger and harming self and harming others and other types of issues. And then, right, they get wiped out. And that wiped out, maybe you're at the hospital, maybe it's inpatient, you receive medication, and you are, I don't want to say stabilized, because you're not, because we're not at a stable. What they do is it just kind of knocks you out. And when it knocks you out, when you wake up, you slide into this depressive episode, okay? Because that can happen as well. And what the research also says, so the research does actually talk about differentiating borderline personality from bipolar disorder. And in all of the articles that I've read, and before all of my videos, I always try to go through the current research to make sure that I'm giving the best information at the time that I create the video. And so all of the research that I looked at, as well as the research that I've seen over the years, somewhere in that article it always mentions the difficulty of parsing these two out. And again, those episodes are so critical and the triggers are so critical. Well, let's go through some of the common research, and the citation is going to be in the comments. The citations of the articles that I'm referring to and pulling some of this information from for this video is going to be in the comments. And so differentiating. So what happens is that differential diagnosis, right, that's separating the two, okay, would be most effectively informed if we asked our clients, okay, we have to ask our clients, okay, the frequency and severity of specific responses to interpersonal challenges, particularly guilt and shame. Now, what we're getting at here is, remember, we talked about this just a second ago, is that individuals with borderline personality disorder typically have that reaction. Guilt and shame is a big trigger for them. And it's this core content trigger that really, it really pushes them to engage in a lot of these maladaptive patterns and behaviors that can be very, very destructive, not only for themselves, but family members, coworkers, people that love them, friends, family members, and things like that. So identifying that's a critical question. The next one is the frequency and severity of persistent shame. Now, I've done a video on shame and borderline personality disorder as well. And here, shame is also, just as we mentioned that guilt and shame is something that can be central to borderline personality disorder. It's really some of that core content, that driving factors. Okay? And the last question is the extent to which these dynamics are problematic in their lives. How are these triggers impacting their life? Because a lot of folks with borderline personality disorder really struggle with this because of past experiences, could be past trauma, could be various experiences that they've had where they have this core content that is fractured in some way, and they're doing their best to manage it and balance it. And it's really hard to do because sometimes it feels like, right, if we look at a scale, and if we could balance that, but a lot of folks with borderline personality disorder, really with my clients, a lot of them, when we try to talk about a scale, and they're like, my scale's never been balanced, how would I ever know when it's balanced? And a lot of times I actually consider that a plus when they're working with me, because then I'm like, if you don't know what balance feels like, let's define it. Let's identify what that balance is. What is that scale? If you don't know what that scale is, then let me help you explore and explain what that balanced scale is. So, individuals with bipolar disorder, it doesn't matter what their scale is, because if they don't receive the right medication, is that they go into these episodes, okay, and it becomes very, very serious. So it's important to seek treatment for those who have comorbid borderline personality disorder and bipolar disorder, as well as those that have borderline personality disorder or, right, bipolar disorder. Okay, so it's important. Now, additionally, what I want to talk about is that borderline personality disorder is most distinguishable by problems with heightened interpersonal reactivity, right, that we just talked about, and guilt and shame, and the shame is persistent over time. Okay, so these are really critical, that's what we're looking at. And a lot of this is not derision to any general practitioner, because I think every individual that I have met who is a mental health provider or a medical provider, they want to do their best for their clients, and they are doing the best for their clients or their patients. And I think that they're trying to help as best they can, but sometimes their skill set may not be as familiar with bipolar disorder, because it is a complex disorder. Not only do you have manic and hypomanic, but you also have depressive episodes. Sort of tracking those episodes, that's something that you could do, sort of track how long those episodes last, and then talking with that about that with your mental health provider, if you have one, with your primary care physician as well, is sort of talking about these episodes. And it's okay to educate your health providers, mental health or medical. And sometimes we have to do that, right? We have to fill in the gaps. They don't know everything. I mean, they went to medical school, but they don't know everything, and it's not fair to expect them to know everything. I learn a lot from my clients, and one of the things that we talk about is sort of that we're going to learn about you together. That this is something that we're going to take this journey together. And I think that in clients that I've worked with that have not had borderline personality disorder but have had bipolar disorder, is that they don't have this fear of abandonment. I'm afraid of connecting with you because if I connect with you, then you're going to leave me. I don't see that in those clients that are trying to manage their scale, manage their everyday activities, their medication, things like that, with the bipolar disorder. But those with borderline personality disorder, they typically see that and say, yeah, well, you say that now, it's just a matter of time before you take off, or something like that. And so we'll talk about that, we'll process that. But that's also a big indicator as well. And sometimes that fear of abandonment and emptiness comes from an even deeper core content of guilt and shame. Okay. So let's talk about treatment approaches. What are the treatment approaches? So what can you do? Well, for bipolar disorder, okay, there's medications. Okay, so bipolar disorder, and often you can start taking medications. They help to balance the moods. Now, for some folks with borderline personality disorder, medication helps. But remember, now the theory that I talk about, the theory that I utilize in my treatment, focuses on a core content, okay, and a surface content. Now, for a personality disorder, medication can't adjust personality. It can manage and lessen some of that surface content. So what's a surface content? Surface content can be rage. surface content can be self-harming, can be depression, can be anxiety, can be psychosis. So medication treats those things, and that's our surface, right? But our core content, it doesn't change that core content. There's no medication so that you don't feel guilty anymore. Okay? There's no medication to lessen the shame that may be at the core content, or those sense of abandonment or emptiness. There's no medication for that. There's no medication for personality, right? And sometimes we'll just jokingly say, well, wouldn't it be great if there was, right? Not necessarily referring to clients, but just other people in general, right? Wouldn't it be great if there was a medication for personality, right? Someone who you didn't like, who had kind of a rough or bad personality, just kind of sprinkle the Be Cool medication. You could sprinkle it in, and they drink it, and then suddenly they'd be cool. But there isn't. So medication for bipolar disorder, there's a lot of different medications where you should talk with your medical provider about that. There's different types that's appropriate. Again, I'm not a psychiatrist, I'm a psychologist, so I want to stay in my lane. I'm not going to go into the different types of medications here. Okay. Now, what else for those who may have bipolar disorder? Now, there's continued treatment. So bipolar disorder requires lifelong treatment. Okay, with medications, even during periods when you feel better. It's important to continue those medications. Now, I've worked with some folks that have had bipolar disorder. Now, they did not have borderline personality disorder, and they had bipolar disorder. And what happened is that some have actually said, I miss my manic episodes. I miss having that sort of carefree, high energy, ability to just go for days and do and feel like I'm accomplishing. So sometimes they miss that. But a lot of times as we process this and we discuss this, what they end up saying is, well, I miss it, but it's so destructive. And we see that, right? Is that those short-term gains have long-term consequences. Okay, so in this case, and we talk about that, the importance of continued treatment, of when you find a medication regimen that might work for you and sticking to it. And even though if you're like, I wonder what would happen if I stop, that's something to really talk about. You shouldn't do that on your own. You can have side effects from cutting down on medication. So it's important to do that, to have continued treatment, to talk with your medical provider, your mental health provider, if you're thinking of doing any medication change, because you don't want to have additional problems and issues. Okay, it's really important. There are day treatment programs. So sometimes a doctor or a mental health provider may recommend a day treatment program. These programs, they provide a lot of support and counseling that you need to try to get you through some of the difficult times. You can always Google day programs for bipolar disorder, or you can ask perhaps your mental health provider might know some. And really sort of explore your options for you in your area. Now, at times, individuals with bipolar disorder have hospitalizations, and this is pretty common for folks that have bipolar disorder, is hospitalizations. And sometimes, because you may need to get stable, you may need to find that balance. Okay, and sometimes hospitalization can help you do that. Okay, so that you don't hurt yourself, so you don't hurt someone else, that you don't engage in behaviors that really have some long-term negative consequences. So hospitalization can be a positive as well. Okay? I don't think a lot of people like that. I understand that. A lot of my clients have hated it when we've had to do that. Some of them haven't minded it, but I think a lot of them hate it. They don't like being taken out of their lives. But I think it's an important choice for them to make so that they can get better and get stable. Okay, so now let's talk about treatment. Now that we've sort of talked about these different treatment approaches, let's talk about like psychotherapy. So is psychotherapy effective for bipolar disorder? Actually, it is. And we're going to talk about some of the key factors here. Now, these factors, the psychotherapy factors, also help borderline personality disorder. So what I'm going to do now is I'm going to go through several different types of psychotherapy that have been helpful for those who have bipolar disorder as well as borderline personality disorder, or those that may have comorbid and they occur together, borderline personality disorder and bipolar disorder. Okay, so the first one, it's called interpersonal and social rhythm therapy. Okay, now what is this? Well, this focuses on the stabilization of daily rhythms such as sleeping, waking, meal times, setting up your life to have a routine and a rhythm, having that consistent routine and rhythm is really important, okay? And it really helps with mood management. Now, this helps with again, borderline personality disorder, comorbid borderline and bipolar disorder, as well as those who just have bipolar disorder. So, and because of that routine, that sleep routine, sleep is so important, particularly for those with bipolar disorder, as well as borderline personality. For all of us, sleep is really important. And I know that sometimes that can really be a central issue for a lot of my clients that have both bipolar disorder as well as borderline personality disorder. That's sleep. How do we get that sleep? There's a lot of sleep hygiene that folks can do. I'd be happy to do a video on sleep hygiene if folks are interested. Just let me know in the comment section and I can add that to my list of topics. I'd be happy to do that. So sleep is so important, and because it really helps to regulate how much we can focus through our day, how much we can manage our emotions and reactions, and also diet and exercise. And a lot of us are like, oh, diet and exercise. Everybody's already diet and exercise, diet and exercise. You ever wonder why? It's because it's so important. And you may be tired of hearing it, but diet and exercise is so important. Fast food is not good for us, and greasy foods are not good for us, and things like that. So it's so important to eat well if you can. And not only does it help with mood management, but it can help with so many other things as well as depression, anxiety, other types of psychological issues as well. And certainly physical and medical issues as well. So diet and exercise is critical. So that's social rhythm therapy, right? What about cognitive behavioral therapy? Well, and a lot of us have heard this if you're watching this video. So what this is the influence of thoughts, feelings, and behaviors and how they interplay. And this can be really helpful with those who have bipolar disorder, borderline personality disorder, or it's comorbid occurring together. And what can happen is with my clients, when we use CBTs, cognitive behavioral therapy, is that we want to identify what those triggers are, identify those emotions inside, right? We know that we've been triggered, because sometimes for those who have borderline personality disorder, those triggers are so fast. And they're like, well, I have no choice because I'm immediately triggered and I have to respond. But you really don't, because when they've been measured in the laboratory, all right, and they really have, there's a lot of research on this, is that you have a little bit of time. This is what therapy does, is it lengthens that time, so that this is where your choice comes into play. And when you are empowered with choice and you recognize those triggers, you can do things differently. You can replace those maladaptive patterns with adaptive patterns, and you really can. You can really do it. Okay, so that's CBT. Now there's also psychoeducation. Now psychoeducation, this is kind of learning about bipolar disorder or borderline personality disorder or comorbid. And it's learning about you and your emotions and your emotional responses, and in some cases your brain chemistry and how you can manage it best, whether it's with medication or with therapy or with both. Research has been done for over the last 60 years saying that the best result actually is therapy, but also medication. Medication alone, sometimes it may seem like that it fixes everything, but a lot of times it doesn't. And I'm just telling you from my personal experience as a psychologist that medication has helped, and there's no doubt about that. But learning those skills, learning those identifiers and those management, and helping my clients, educating my clients on what those triggers are and what borderline personality disorder is, bipolar disorder, other types of disorders and issues and triggers and all of these things. That's the psychoeducation part, and that's really important. And that's the therapy part, okay? And then there's family-focused therapy. Now, for those with bipolar disorder, a family-focused approach is really good, because this can help the individual, because sometimes those that when they're moving into a manic phase, especially when they're first sort of learning about themselves and their episodes and things like that, is that they may not be able to identify those triggers, right? Those indicators is better than triggers. So let's call them indicators that they're going into a manic episode. I had one client, she goes, I know that I'm going into my manic episode because I knit feverishly, right, for days and days, and I know that I'm sliding in. Once I start picking up her knitting needles, she would begin to knit, and she was almost not able to stop. It was like feverishly that she would knit. And she would knit all these hats and blankets and different types of things. She's like, that's how I know that I'm getting into my manic phase, and I know other things are about to happen. And then, so at that time, she would then contact family or other folks who could help her sort of stabilize her mood. in her reaction. Okay, so family-focused therapy. I know folks with, and this is for a lot of folks, not just those with borderline personality disorder, is that sometimes their family isn't a source of support. And so family-focused, your family doesn't have to be your mom, dad, brother, sister, cousin. Family-focused therapy can sometimes bring in positive others that can help you identify what those triggers are, people that you can reach out to that can help you as well, who can help you stabilize your mood, not engage in self-harming, not engage in drug binging or sexually acting out or anything like that. Okay, so that family-focused therapy is also helpful as well. And again, as we kind of wrap up, it's so important to remember that these two diagnoses are often confused, even by the experts. And what we want to do to identify the two, and I know I've said it several times, and it's important, I think, to say it several times to make sure that we get it, is those episodes for bipolar disorder are so important, and those triggers. And what is that core driving factor, right? What's the core structure of a lot of those borderline reactions? And you may be saying, well, great, you think you have both. Then what I would do is I would sort of start tracking those moods. How long are those moods? And describe them. This is what I think, my manic episodes are and how long they last and the behaviors and thoughts and things that I'm engaging. And then do you find yourself sliding into a depressive episode? And how long are the depressive episodes lasting? And go to your mental health provider and discuss it with them. And so that they're aware, and you guys can discover this together so that you can reach stable ground. And with borderline personality disorder, the same thing. Both of these disorders are treatable. Even if they're comorbid, that doesn't mean they're not treatable. And I hope that in this video that's what I've conveyed, that's what I'm trying to convey, is that as confusing as it may seem and overwhelming as it may seem, these are treatable disorders, and it is possible to build that scale if you feel like you don't have one, or find that scale of balance, okay, that it is possible. And I hope that this video, that some of the things that I've talked about, has been a resource for you to help you do that. I really hope so. Please leave any comments that you may have. I appreciate that very much. And thank you for your time and attention. And I hope you enjoyed it. I have a new backdrop, so I hope that folks like that. And please comment on the backdrop if you like it. And thank you very much for your time and attention. And please take care. Be well. Bye-bye.